to 2025. This is the first podcast for me of the new year. I know we are a couple weeks in. It's taken some time for me to just get back into the swing of things. The holidays have been kind of slow as far as practice and my business. This podcast isn't, really part of my business. It is, but it isn't. It's something that I like to do, and I like to talk and share different things with whoever may or may not be listening. And so with my practice, I'm recognizing and realizing that some of the terminology that I use doesn't mean or isn't getting a point across that I want it to. So I want to talk a little bit today about what those differences are between the words holistic, integrative, and functional medicine or health really mean. And even when I talk about them, different people may have different definitions of what those mean. But I just want to talk about this because I've been noticing it not only with my clients, but I notice it with my friends, my colleagues, my family. And I want to be able to work with people who want the same things as maybe I do. Now, it doesn't have to mean that they want the same things in life that I do. As a therapist, that's not really what I'm trying to do. I don't have to be the same as everybody. But I have a passion for holistic, functional health, and I want to share that with people, and I want to help people who are also exploring that for themselves and maybe interested or already there. So as far as counseling is concerned, if you are trying to or already lead a more holistic lifestyle, focus on wellness, and you try to implement certain practices in your life, which, we've talked about here on the podcast. If, this is the first time you're joining me, typically that means more herbs, more natural things from nature, less medication, although, there's a time and a place for medication. But once you get into the lifestyle, you start to realize that there are a lot more uses for some of the natural things we have in life and around us every day, that can heal us and keep us healthy and help us to flourish and grow. So those are the types of people that I enjoy really working with, and hopefully they enjoy working with me. I know, just from some of the clients that I have, some of them have found me because of that. Some of them specifically want to work with me because they know that. Some people come to me and they have no idea that I also incorporate those things into my practice. And so they learn those things, and then they, maybe explore those things. I don't force it on anybody by any means. So if you come to me and that's not your thing, then that's typically not something I talk about. But I may inform you, I may share some things with you, I may ask if you've considered X, Y, or Z, just to kind of provide some psychoeducation, as we call it, and see if maybe that changes your perspective, see if that kind of opens your eyes to other options. Okay. So that's enough about me and my practice, but for the meat of what I wanted to talk about today and where why I wanted to focus on this. So you probably hear the terms holistic health, holistic wellness, integrative medicine, functional health, functional medicine, functional mental health. And I've been utilizing the term holistic for my practice for most of the last year or two, specifically the last year when I created and opened my new practice, 𝗘�57 Still really the same practice, just changed names. And again, I started utilizing that term holistic. And, I'm finding that as I am in this field and as I host luncheons and as I get to meet and know other people, I see that term used a lot. And I find that it doesn't mean maybe what I think it means in my head. And people are using it correctly sometimes, maybe not all the time. And for me, it's important to try to give across that message that, clarity that I want people to know and understand. So holistic means, typically, if you look up holistic, that you may see some version of the combination of physical, mental, emotional needs and having like a whole body approach or focus to health, mental health, life. Some will include spiritual health in there, and any other layers I may be forgetting. But basically, you're just trying to look at the whole person, holistic, right? And that's important. We want to have a holistic approach, but not everybody does. In counseling, we think that we take a holistic approach, but generally, like, we're covering all the bases. I'm going back to grad school, and when I worked in a psychiatric hospital, my first, my internship and then my first job, we had a template, we had a form, and we had to, hit each area on the form. We had to fill it out and get as much information as possible, right? That's what we do in counseling. But what we do with all of that information may not be holistic, right? We're trying to be holistic. We're trying to cover all the bases. Tell me about your spiritual health. Like, are you religious at all? Do you have any spiritual practices? Tell me about your family history. Tell me about your exercise, your diet, what you do for fun. Like, we cover all those things, but then it just kind of sits on the paper. Oftentimes in mental health, we're focused on, okay, you're anxious, you're depressed. Why are you anxious? Why are you depressed? How can we get you not anxious and not depressed? And what are the things that we can do? But are we considering all those other things that were on the paper and what effect those things might be having on the depression and the anxiety? Personally, in my experience, I would say that no. Many mental health professionals are not taking that into consideration, and we should be. And I know I wasn't up until a certain point, and that started to change for me, and I wanted to know more, and I wanted to do more, and I took courses, and I learned more, and so now I think differently, and I look differently at something. So when somebody comes in saying, they're really depressed and, they're not doing X, Y, or Z, and they, can't get motivated and, this and that and the other, I'm also wondering, well, what are you eating? And okay, is there anything we can do about that? And are you getting out much? And how much time are you spending on your phone? And, do you have a belief system? Do you have a support system? And, have you been to the doctor recently? Have they tested your vitamin D? Like, all of those things are things that now I incorporate into the questions that I ask, into the things that I talk about with people. So that is more of a holistic, right? Then we get into integrative medicine or integrative health, and that's traditionally taking more of a traditional approach to health. So that's that, like, allopathic medicine, the traditional, like, medical system. But they also, try to look at some of those holistic things, and they may combine traditional medicine with some unconventional or non-traditional treatment approaches. So, we may use medication, but we may also say, hey, like acupuncture, chiropractic care, maybe some herbs, right? We may combine the two. And I'm not saying that that's wrong. Every person is different, and every person has different needs. But that's what integrative is. It's not all one, it's not all the other. We're bringing the two sides together. And then in functional medicine, or like functional mental health, we're looking at treating those underlying causes. And, it's more of an individualized approach. Now, every doctor is going to say that it's an individualized approach, but if you say you have cancer, the treatment is what? Chemo, radiation, surgery, right? It doesn't feel very individualized. Now, yes, they're going to look at you and they're going to give you a certain amount or something, but they're not going even deeper, right? Functional medicine would say, you have cancer. Where did the cancer come from? Yes, we want to kill the cancer. Yes, we want to get rid of the cancer. Yes, that is important because obviously it's causing a problem in your body. But where did that cancer come from? What is causing that cancer to do what it's doing to begin with? And can we backtrack that a little bit? Are there any things that we can change? Are we just giving the cancer, chemo, and we're not changing anything else? Unfortunately, I hear that a lot. I see that a lot in posts online, even just like what I used to see. And it's really sad for me to see people and doctors even saying like, you don't have to change anything. You don't have to change anything. You have cancer. We're going to treat it, but you can keep, living your life. Well, you got cancer for a reason. And I'm not perfect by any means. And, I could be doing things wrong, and I know I'm not there yet. I'm still learning, and I'm still working on making some of the changes that I talked to you about. So it's hard. Making change is hard. I just use cancer as an example because it's a fairly common thing that we see where the treatment is the treatment. And that is not a functional approach. A functional approach would be specific to you. Let's get some blood markers. Let's get some more diagnostics to see like what more information we can do. Let's see what your hormones are actually doing and why the cancer formed to begin with. So then we can attack that while also maybe needing to do something. Maybe it's chemo, but maybe it's some other form of treatment. I don't know. I'm not a doctor. I'm not here to say that. I know that there are other approaches to many of the things we suffer from. I think the problem is we don't know. We don't know what we don't know. And there are providers out there that do know. There are providers out there that have done the work, that have done the research, who have treated people for all kinds of ailments in a natural way without medication. And then there are times where, medication may be needed. I am encouraging you to explore that. So one of the reasons that, this comes up for me is, you know your body best, okay? Now, what may get in the way of you knowing your body best is when you have maybe a lot of anxiety, or if you have a lot of, health worries, and, any little thing you get worked up about and you go to the doctor about, or you have to have a scan about, or you have to have something done about it, right? We may need to work on your anxiety before we work on like that intuition and trusting your body. But I'm not saying that gets in the way of you knowing your body. You know your body. And what I've seen happen for my clients, my friends, my colleagues, my family, I've seen this happen all around. And what happens is doctors, or other providers, maybe push you around, right? You come in with a symptom, your symptom, it's not right, and you're explaining it to them, and they say, oh, it's blah, 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 take this. Okay. And you're like, I really don't think that's what it is. Well, do that for a little while, come back. And maybe you insist on seeing a specialist, or, getting a referral, and maybe they push you off, or maybe they give it to you. But again, they don't think there's anything to whatever you're experiencing. And so then you just get pushed around from doctor to doctor, specialist to specialist, because what they're doing is they're looking at oftentimes, your like individual organ systems, or, a certain area of the body. Like, we're going to look at your thyroid, and that's all we're going to look at. You come in with gastrointestinal stuff. We're just going to look at your gastrointestinal stuff. We're going to look at your gut, but we're not going to look at anything else. You come in with a heart problem. Well, we're going to look at your heart, and we're not going to look at anything else. And that's why you see a heart specialist and a gastro specialist, an endocrinologist and a hematologist, and you have all these people you're seeing, and they're all looking at their specific area, and they're not taking a big picture approach, which then that's how things get missed. That's why I think people get so frustrated. So recently I just had a friend who had something like this happen. They knew something was wrong, and kept pushing and pushing and pushing and pushing. And, they've been miserable. And finally, like, they have an answer, but the answer was actually found a long time ago, and it, wasn't ever told to them, and nothing was ever done about it. And I've had, clients who've had similar things happen, where they've had to advocate, they've had to push for themselves, like, no, I know what's going on, and I know that's not going to help because I've either done it, or I know because I've done my own research. I know that I can't have that product because that product contains something I can't have. And you as my doctor, I would hope, would know that. And then they don't. right? So you have to become your own advocate. You have to do your own research. You don't trust just what I say, because I could be wrong. But I am trying to provide you with information. I'm trying to provide you with a different perspective. So go research, go look it up, go talk to different providers, go talk to different doctors. If you are in like the medical system, it's okay to get a second opinion, because doctors have different perspectives and different opinions on things. And if that's something you're able to do, I would encourage you to do that. And then if you are tired of the medical system, which I have numerous people I know who are at that place in life, like I'm over it. They're not helping me. And they're ready to look elsewhere. There are tons of other providers out there that can give you other perspectives. Unfortunately, in the world that we live in, functional medicine, sometimes integrative health, holistic health, wellness, naturopaths, homeopaths, none of these people are going to take insurance. You're going to pay out of pocket for all of these things. If you have an HSA, they may or may not, cover, you may or may not be able to use those funds to, for those services. I think you should. But I, don't know. Each individual company will determine what they will and will not cover. And so that's a barrier. I mean, even for me, I'm a private pay counselor. And so it's a barrier for people to come see me because, I'm not covered by insurance. I don't want to be held down by the rules and expectations of insurance that dictate what you should and should not do when they aren't looking at a whole person. Unfortunately, they're looking at making money, and that means not taking you seriously. That means not covering some of the things that you need, the testing that could benefit you, because there's so many reasons. I could do a whole session on that. So we're not going to go into insurance today. That might be a good topic for another day, is to talk about why I and other providers don't take insurance. Today, just focusing on that holistic versus integrative versus functional health and medicine. So for me, I'm wanting to focus more on that functional medicine approach, that root cause. Where is this coming from? Along with therapy. So therapy is my focus, but how we get there, what we're talking about, that's where the functional, holistic piece comes into play. I want to know about some of those other things that are going on, because that gives me insight into how your body is functioning as a whole. And I can't do the testing, but I can give you referrals, or I can talk to you about how you can talk to your provider about the specific testing that you may need or want. Does that make sense? I hope you maybe found this helpful. I know that in doing some research myself, I found that maybe the way I talk about things needs to change to be able to get my point across better. So I'm not just a holistic therapist. I'm a holistic functional mental health provider. I tend to look at things differently. And if that's something that interests you, I would love to talk to you. Thank you for joining me today. I hope you are having a good start to the new year, 2025, and there is so much more to come. And I will see you next week.